The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.
The dollar figures are staggering. Hundreds of billions in new spending. The federal government issued its fall economic statement on Monday, and tonight we'll find out what it proposes to deliver for Ontario. Then, seniors and their families are staying apart to keep everyone safe during this COVID-19 crisis. We'll consider whether that's the best approach for their overall health and well-being. It's Wednesday, December 2nd, and that's next on the agenda. Finance Minister Chrystia Freeland unveiled the federal government's economic update on Monday. It laid out almost $400 billion in federal spending. Ever since, reaction hasn't been exactly glowing, including here in Ontario, where Provincial Finance Minister Rod Phillips described it as a missed opportunity. With us for their insights, all in the nation's capital, we welcome, in Britannia Village, Kevin Page. He's the former Parliamentary Budget Officer, currently CEO of the Institute of Fiscal Studies and Democracy. In Centretown, Angela McEwen, Senior Labour Economist at CUPE, the Canadian Union of Public Employees. In Orleans, or Orléans, if you prefer, Erin Woodrick, Federal Director of the Canadian Taxpayers Federation. And finally, Marika Walsh, political reporter for the Globe and Mail, who's in her newsroom in downtown Ottawa. And it's great to be with you all tonight on TVO. Kevin, you were the numbers guy on Parliament Hill when you were the Parliamentary Budget Officer, so I want to start with you. Start by just pick whatever two numbers you like from the other day and tell us why you think they are perhaps the most important numbers for our viewers and listeners to better understand.
Well, that's a good question, Steve. So, there's a lot of numbers. There's 250 pages in the document. There's numbers pretty much on every page. I think maybe one number I would say I would go just to the economy, to GDP. The estimated decline in GDP in 2020 is now at 5.8%. That's that's a record level of decline in output. Since the Great Depression. I think that behind that number, of course, is a lot of hardship with respect to various sectors of the economy that are still pretty much in lockdown, and again, the level of employment that is still some 650,000 or so less than what it was in February before we went into the lockdown because of the virus. I think another number, Steve, might be, well, we have to pick a fiscal number. It would probably be the debt. I think, as a percentage of GDP now, we're seeing federal debt, which is kind of gross liabilities, less financial, non-financial assets, now in the range of 50% of our gross domestic product. It's an enormous historic increase in debt in 1 year. And that, of course, was symbolic of the fact that the government thought it was absolutely needed to backstop the economy. So two numbers, GDP and federal debt.
Good. Here is how Chrystia Freeland, the federal finance minister, justifies the record level of spending that includes all of those numbers that we just heard from Kevin Page. So Sheldon, let's hear that, please.
This is the most severe challenge our country has faced since the Second World War. It is our most severe economic shock since the Great Depression, and our most severe public health crisis since the Spanish flu a century ago. Canadians should know that their federal government will be there to help them get through it, come what may.
Erin Woodrick, that is the explanation behind the record spending. Do you think it justifies it all?
I don't know if it justifies it all. I don't think anybody disputes that this is obviously a very unique situation. We're going to have to spend a lot of money. There was no getting around that. But I think it's dangerous to just assume that every dollar that they send out the door is justified. I mean, just to take one example, we learned this morning that in the third quarter of this year, household incomes dropped by $15 billion, which is a lot. But at the same time, government transfers to households increased by $100 billion. So effectively, the government has replaced every dollar of lost income with $7 in borrowed money. And I don't think that there's anyone that would have a problem with trying to replace every dollar with a dollar. But I think it's fair to question whether the programming they have right now is targeted well if you're sending $7 out the door to replace every dollar that's been lost.
Angela, fair point?
I do think it matters how you spend the money. It's not just how much money you spend, it's how it's spent and is it well targeted. For example, the wage subsidy, they've had a lot of problems trying to design that in a way that is actually well targeted. And they keep changing the parameters of the program a little bit. So the CERB, that money goes directly to people that have lost income because of COVID, because they're not working. But the wage subsidy, that goes to everybody at the business, whether or not they were going to be laid off. So that's not as well targeted. Is it justified? Is it helping businesses stay afloat? And so maybe the household replacing the dollar isn't the best comparator for the wage subsidy. But yes, I think we need to have some oversight. We need to have thoughtful interventions. And the size is not the only thing that we should be looking at. We should be looking at how well it's being spent.
Okay, more on that in a bit. Marika Walsh, I did want to ask you, because you spoke to the Ontario Finance Minister, Rod Phillips, before the statement was given. What was he looking for in the statement?
The key thing he was looking for is something that was not ultimately in it, and that is an increase or the signal of a possible increase to the Canada Health Transfer. As you well know, there are some serious challenges over the long term to the structural funding for Ontario's healthcare system. And Doug Ford's government wants to see Ottawa pitching in more money. Right now, the feds pitch in about 22% of all dollars to the healthcare system. And the Ontario Premier, the Ontario government, as well as provinces across the country want to see that hit above 30%. And so that's going to be discussed in the meeting next week with Prime Minister Justin Trudeau. But certainly it was made very clear to reporters in Ottawa that that has so far not been budgeted for or accounted for in what we saw this week.
Kevin, I wonder if I could get you to weigh in on that, in as much as Rod Phillips called it a missed opportunity to do something big and important on health care. Would you share his characterization of that?
Well, I think it's still premature, like to make that point. I think again we're still months away from a budget. I think the budget, well, with the vaccine that is out and being distributed, a budget in March, we really kind of look at how will we not only stimulate the economy, the post-COVID economy, but how are we going to deal with some of those structural changes, around climate change, around healthcare, around inclusion. So I think to look for a fiscal update and say we need a big signal. It might be a little bit premature. I think there's a lot of literature in that budget that speaks to just the heavy, load that the federal government has carried during, the COVID-19 lockdown. There's numbers in there. Another number that kind of speaks to, out of really every dollar spent, is pretty much the feds have been kicking in 80 cents, in terms of total, government, federal, provincial, territorial government spending in terms of COVID support. So I'd say we better wait to the budget before we really talk about the future of healthcare spending.
Right. And just to be clear, this was a sort of economic and fiscal update as opposed to a budget, although there were some, quasi-budgetary items in here, which we'll talk about in a second. But Kevin, let me do a follow-up with you. Did you share Aaron's concern that, X number of dollars were being lost, but by his math, 7 times X was going out the door, and he wasn't clear that it was all going to relevant or useful things?
Well, I think Aaron's asking good questions. Is it possible that we got the size wrong on this, on the fiscal support package, that it's actually too generous? I think when you look internationally, it's clear that Canada had probably the biggest fiscal support package relative to the economy in advanced economies, in the OECD economies. I don't think really anybody's overspent us. So it's a fair point. There's different ways to look at these numbers. I think you could look at the income numbers and the transfers and just the people's reactions to savings. You can also look at these massive declines in output. They're both pretty significant. I think some of this will sort itself out. There's some positive upside surprises potentially. A lot of people are saving some of this money that we might see some higher spending. And, in 2021, and the minister talks about, the reduction of scarring, that maybe we'll have less scarring because we spent a lot of money up front.
Angela, let me follow up on these items that kind of appear budgetary, even though this is not technically a budget. And for example, retrofitting homes. They're going to spend money helping people to subsidize the expenditures around retrofitting homes, making them greener and so on. What do we think of this initiative?
So I think that homes need to be retrofit. I think that this will probably more likely benefit wealthier people, and it will not benefit those who need it. So it's not a well targeted for the moment. It's not well targeted for climate change. I don't think it's necessarily the best bang for our dollar. Here we have people who rent who are getting evicted, and who we have increasing food insecurity. And so this certainly wouldn't be my priority for public spending. I don't think that we're in a situation where the federal debt is so cheap. It's 1% interest. So we're asking the federal government to borrow at 1% and to spend it in a targeted way that keeps the economy going, so that renters can keep paying rent and can keep buying food. And instead of having those renters have to take out payday loans or put money on their credit card and pay 19% interest on that debt. So
no, I get. Hold on though, but that's a separate point. I'm going to get to that later about how cheap it is to borrow money. I just want to really focus on this program here. Aaron, what's your view on this retrofitting program?
Yeah, I agree with Angela a lot, and we agree more than you think, actually, sometimes, Steve. But it's look, this is an issue that is climate change is a longstanding issue. It's a priority issue, but it's not related to the pandemic. And this is what I was talking about when I talk about not questioning any of the spending. There's no question some of the spending right now is necessary. I don't think anyone's going to dispute things like spending on healthcare, on PPE. But is retrofitting homes right now, when you're facing a situation where the deficit has just grown 20-fold in a year, is spending money retrofitting homes, especially for wealthy individuals, is that the highest priority for spending? I don't think it is. Okay.
Marika, I want to get you to focus, if you would, on the taxing multinational digital giants. This is sort of the Netflix, Amazon Prime, all that business. You know, this was something I do remember Stephen Harper well campaigning, saying there will be no Netflix tax if the Conservatives are reelected. They weren't reelected. What are the politics around putting a tax on something that hasn't been taxed heretofore?
The politics around it are a fewfold. We got to remember that we're in a minority government, so this government needs to get the support of the NDP, for example, who have been long championing more taxes on these multinationals for the revenues that they make in Canada. This tax is on consumers, so we will now be paying, or when it's implemented, we'll be paying consumer GST, HST on these Netflix subscriptions and other subscriptions. The NDP argument for this is that it levels the playing field, because then when a local company is selling this, they still have to charge consumer taxes. And until now, international conglomerates have not had to. And so that's the leveling of the playing field that they're talking about between domestic companies and international companies. The question is whether this goes far enough to get the support from the NDP. The NDP say they also want to see corporate taxes on the revenues that these companies make from Canada. And so, you know, there is going to be, I think, still some bartering on this plan.
Kevin Page, can I get you to weigh in on the advisability of this new tax?
Yeah, so I think that the taxation of digital companies, the taxation of wealthier people, these are going to be big issues that we're just going to live with over the next 10 years. You know, the economy is becoming more digital. We're going to have to find ways to tax. A lot of, you know, public concerns around just, you know, through the COVID period, there are a number of companies that brought in making huge amounts of monies. And so, you know, should they contribute to the, you know, the common good, basically helping people while we're dealing with the pandemic. So, but I think fiscally, again, back to the numbers, if you look at the amount of monies we're going to revenue with some of these tax measures, or rather they're going to contribute to kind of deficit reduction, it's not even a drop in the bucket. We're talking about, you know, a billion roughly a year, when we're dealing with a deficit of $380 billion, dropping to maybe something in the $130 to $150 billion range next year. And we're talking about increasing taxes by $1 billion. So, I mean, the real discussion is being punted. We're going to have to raise revenues in a more significant way, but it ain't going to happen in the next couple of years.
But this, Aaron, is one of those shiny baubles that people do tend to look at and say, okay, I'm getting taxed for something now that I didn't have to pay tax on before. Yes, it levels the playing field for Canadian businesses, but what's your view on it?
Yeah, it levels it by making consumers pay more. And remember, you heard Justin Trudeau and his finance minister come out saying the last thing Canadians need right now is higher costs. And that's what this does. And I completely understand no one's shedding any tears for Jeff Bezos or the Weston family. They're doing great. They've got billions. But the problem is, first of all, even if you can get them to pay, as Kevin said, it's nowhere near enough. You're not going to, if you raise $6 or $7 billion on a $400 billion deficit, you're really not making any headway. And secondly, they're not even paying it. They're just passing it on. I mean, Netflix and Amazon are being enlisted, like every other business, to collect taxes from Canadian consumers. So you're not really getting big tech here. You're just making consumers pay a tax that essentially they were supposed to be paying all along.
Okay, let's put two expressions on the table here, and we'll get some discussion on this that our viewers and listeners may not have heard before. We heard Minister Freeland talk about fiscal anchors and fiscal guardrails. Kevin Page, why don't you start us off on this? What do those things mean?
Yeah, so fiscal anchors is a term that has become popular really since the 2008 global financial crisis, where a lot of countries experienced big increases in debt. So again, what is a prudent level of debt for a country? Are there sort of levels of debt for some countries who are going to have difficulties borrowing, or they're going to see downgrades with respect to their bond rating? So I mean, a prudent level of debt. Again, we can see in this fiscal update, the government in its medium-term forecast is now talking about debt to GDP numbers in the 55% range. Again, in 2019, it was sitting at 31%. If you go further back in the 1990s, federal debt was probably, north of 60, it was in this about 65, 66%. So what is the, fiscal anchors, like, is there a medium-term debt target that we should be moving towards? And then fiscal guardrails is really, some people call them fiscal guardrails or rules. How do we make sure that the government is actually moving in that direction to that appropriate debt target? Guardrails is being used in this document more around shaping the stimulus. And the minister has signaled that she wants to use labor market indicators, which I think is a very novel idea. I'm sure Angela would want to pipe in on this. And it's actually possible that if we have a speedy recovery, and Aaron will like this, if we have a speedy recovery and we get back to employment levels or working hour levels or unemployment levels that we saw pre-COVID, we don't need stimulus. Because the government can basically, if we use those guardrails appropriately, it could actually say that stimulus is really not necessary because the economy is functioning just fine. Okay,
Angela, pipe in.
Okay.
Yeah, absolutely. So I do think it's important to note that we saw the biggest drop in the labor market since the Great Depression. We saw levels of unemployment where a third of working Canadians were out of work. And that's huge. And we have students that are graduating into this labor market with huge amounts of debt, and they're getting it they're getting the interest on that put off for a year. There will be long-term wage scarring effects for those students who are graduating right now, for the people who were laid off and haven't been able to get back to work for the past 6 months. So I expect that we will need stimulus for some time. The International Monetary Fund is saying, the chief economist there is saying she thinks we're in a global liquidity trap, which means that monetary policy can't do anything. And to stimulate the economy, we're going to need federal governments like ours to step up and keep funding to get us past the edge of this crisis, and to keep going once the public health crisis is over, because there will be scarring effects from this extended shutdown. You're going to have businesses that have gone bankrupt through no fault of their own. There's nothing they could have done to plan or prepare for this, and workers like in the airlines. So there are going to be long-term effects in very specific industries. And so I think it's really good that they talked about fiscal guardrails. I think it's really good that they talked about the labor market effects, because that's really where we should be watching. That's what we want to make sure that people are able to make ends meet, that there's a broad recovery. We saw a really long, drawn-out recovery from the 2008 crisis, and that's partly because we bailed out the banks and we didn't bail out people. Hopefully we learn from that, and we're taking a different approach this time.
Okay, Marika, maybe pick up the story there. To the extent that I've heard criticism about this financial and economic statement, it's that there wasn't a lot of specificity around when the fiscal guardrails and anchors, et cetera, when they actually kick in. What can you tell us about that?
Yeah, there was virtually no specificity on that, and also how they will define those guardrails. Does it need to be 2019 or 2018 economic numbers before unemployment on hours worked before they remove that stimulus? None of those things have been spelled out. The finance minister said that would come in the months ahead when they also release their stimulus plan, which also has very few details and is not actually yet added to the budget's bottom line. And so that's really going to be something that we see, I think, around the next budget in the spring. And I think also questions around when a vaccine comes are going to guide the timing of these next steps, because even the finance minister, the opposition is saying this very clearly, but the finance minister also acknowledged this week that having a vaccine is what allows this economy to reopen in a more meaningful way.
Sure. Aaron, I wonder if I could get you now to pick up the story on the issue actually that Angela brought up a few moments ago, which is, money's just dirt cheap right now for the government of Canada to borrow. And if you need to stimulate the economy and if you need to protect people from the worst ravages economically since the Great Depression, you can't do it much better than when you're borrowing money at 1%. In which case, isn't this the time to go deeply into debt if you have to go deeply into debt?
Well, there's if you have to go deeply into debt right now. I totally agree that, the economy is going to need some help. I think that the fact that so much of that money, remember the 7 going out the door for the every dollar, a lot of that money is being banked. And there's a reason a lot of people who have banked it can't spend it. They can't travel. They can't do the things they want to do. So it's very possible, as Kevin said, that we may not need some of that stimulus. And that's why I love the idea of guardrails. I just like to know what they are. And I'm hoping that we will get that in the spring. And my fear is the reason that they haven't told us what they are is that they're going to set them up in such a way that it will justify whatever stimulus they want to spend. And the reason I think that is they've already announced they intend to stimulate without even knowing, on what basis or when they want to do it. And I find that very curious. Usually you shape a policy around saying, we want to do this, and then we find the money to do it. You don't say, we're going to spend X, and then we're going to find things to spend it on. So to your question about the price of debt, look, obviously it's better interest rates are low. It's the only reason we're not in a crisis already. But I think just assuming that they're going to stay low forever, and remember, a lot of the debt we're taking on is not long term. A lot of it is 5-year bonds, not 30-year. They're changing that now. But it's a bit like saying I went to the casino and I had a really lucky night. So I'm just going to assume that every night is going to go the same way it did last night.
Gotcha. Well, let's talk about one of the real big ticket items that came out of yesterday. And the commitment to spend billions and billions isn't quite there yet. It's still in the let's see what we can do phase. Here's Chrystia Freeland on childcare. Sheldon, roll it if you would.
I say this both as a working mother and as a finance minister. Canada will not be truly competitive until all Canadian women have access to the affordable childcare we need to support our participation in our country's workforce.
Kevin Page, everybody's saying this. Everybody is saying that if there's anything good going to come out of this COVID-19 pandemic, it's that finally governments are going to get serious about putting a national childcare program in place. However, the fine print always says childcare is a provincial responsibility. We've tried going down this road so many times in the past and haven't quite got there. What makes anybody think this time is going to be different? Let's start off with you, Kevin, on this one.
Again, you're asking really tough questions, Steve. So this is, I would say on this, that I think there's a sense, in the context of COVID-19 that there's a possibility of doing, people use the word social resets or strategic resets. And then you start to realize that, what has happened to us and, the impacts that Angela's talked about in big parts of the labor force. So, going forward, is there an opportunity to change? And with respect to the federal provincial aspects to the childcare discussion, I think the government is going to be very careful. Really, all they talked about in terms of funding this is to study it. Really tens of millions of dollars to study how could possibly we bring this about. But if we're really talking about a big program and it's going to need tens of billions of dollars across the country in order to create a Quebec-style program, then we're just going to have to be honest that we're going to have to raise taxes. And again, I think that's the conversation for childcare, but I think there's going to be other programs, basic income programs, potentially even some climate change type of infrastructure programs. Taxes probably will going to have to go up over the medium term as we get through the crisis.
Angela, I know Rome wasn't built in a day, but I suspect there are some people who were hoping that they'd see more than just the promise to create a secretariat to look into how to doing this. Were you disappointed with this part of the announcement?
Absolutely. All of the narratives leading up to the speech and the speech itself indicated that the government was ready to take this seriously. We have in Ontario, about a third of childcare centers have closed because of the increased expenses of delivering care in a pandemic. And mothers are talking about just staying home instead of going back to work. And so, especially if you have children under 6, there is action they could have taken to support existing childcare centers in staying open to deliver care right now, the way that they're delivering $1 billion to long-term care homes. So I was hoping to see something like that. I was glad to see some money around training. That's a lesson learned from Quebec and how Quebec implemented that they didn't have enough skilled workers. And so to get started on the training, I think is a good plan. But there's definitely going to be a lot of skepticism because this has been promised several times in my lifetime and it hasn't come to fruition. And I just want to say this is not a social reset. This is an economic reset. If we had childcare for all children, it would contribute $1 billion to the economy, which is as much as the stimulus that the federal government is. So this is stimulus providing childcare because those mothers can then go to work and then they pay taxes and spend money in their communities. And it creates jobs that were previously unpaid, that were not in the economy. So it creates jobs at childcare centers. And I really hope that we have a focus on making sure those are good jobs and that those workers are paid good wages.
No, I get the economics of this, but let me go to Marika.
But a lot of people miss it.
Okay,
yeah.
We've talked about that numerous times in this program, but I do, politics is the art of the possible, and I want Marika to jump in here now and talk to us about the fact that I guess it was maybe 15 years ago when Ken Dryden was the cabinet minister in charge of this in Paul Martin's government, that they did sign national child care agreements with all the provinces. Then Stephen Harper's government came in, canceled them, and now, here we are 15 years later and everything old is new again. What's possible on this file this time?
So I think what's really interesting to watch is how much Chrystia Freeland has staked her own personal interest and priorities on that. I think that the fact that the finance minister has made this such a big issue in terms of her priorities elevates the expectations that this actually does get done, and also elevates the political risks for the Liberals if they don't get it done. I think that people in the fall, when they first saw this again in the throne speech, there was skepticism, as Angela said. I think there still is skepticism, but that skepticism is now being matched with these very decisive comments from Chrystia Freeland about how much of a priority it is and how she wants to, quote, get it done, and now is the time. And so she has really raised the expectations, and I think that we should expect to see something in the spring budget that at least starts to try and meet those expectations rather than just simply this 5-year panel planning ahead on it.
Aaron, about a minute and a half to go. What's your take on it?
Well, I'm a father of 3. My wife and I have put 3 kids through daycare, so we're fully aware of the cost. But I feel like sometimes, Steve, in this country, when we have an issue that's really important, people forget that some things are things that the federal government's responsible and some are provincial responsibilities. And daycare is pretty clearly a provincial responsibility. If a province wants to do one of these programs like in Quebec, they're fully free to do. And the reason that they haven't is it's very expensive. And so, I appreciate that it's an important issue. Again, I personally experienced the cost of this, and it is a substantial cost. But I don't think we can just set aside, whose responsibility it is just because of the importance of the issue. And I think this is one example of a permanent program that's substantial cost that we're going to have a conversation about going forward, because it is going to have to mean, as Kevin said, higher taxes. People love stuff if they think it's not going to cost anything. When you say they are going to have to pay for it themselves rather than, Jeff Bezos and the Westons, I think you get a more real feel for what they're willing to accept.
And Marika, in our last 10 seconds, government's not going to fall over this statement, is it?
I mean, I highly doubt it. I don't think that any voter would be appreciative of being sent to the polls right now. So I don't see that happening. But you never know, Ottawa, Steve. So I won't rule it entirely out.
You never know. That is so true about politics. Kevin Page, Angela McEwen, Aaron Woodrick, Marika Walsh. Really good of all 4 of you to join us on TVO tonight. We should get this group back together again after the real budget comes out next year and weigh in then. Thanks so much, everybody, and stay safe out there, eh?
Thank you.
COVID-19 has hit seniors hard, and not just in long-term care settings. For the vast majority of seniors who live independently in their own homes, it's the months of social distancing and staying apart from family that have been extremely hard. And for many, it's taking an emotional, mental, and physical toll. Are such sacrifices doing more harm than good? Let's find out as we ask. In Ontario's capital city, from Mount Sinai Hospital, Dr. Leslie Weisenfeld. She's psychiatrist in chief for Sinai Health. And Dr. Nathan Stahl, a geriatrician at the hospital and research fellow at the University of Toronto. And in Calgary, Alberta, journalist Christina Frungu, who specializes in writing about health and recently wrote about this for Maclean's. And we're thankful that all three of you could join us on TVO tonight. And Christina, I do want to start with you because in your recent piece, and I guess I'll ask our director, Sheldon Osmond, to bring this picture up. This is, boy, that picture is just haunting. And for those who are listening on podcast and who can't see it, it's an elderly gentleman, I'm going to guess in his late 80s, with a pained expression on his face, hand over his mouth and chin, and he just looks, well, go ahead, Christina, you describe it.
Well, this is George Spalding, and George is actually 96 in this photo.
Oh my gosh, well, he looks fantastic then.
Yeah, he does. We should all be so lucky as to be in the shape George is at 96. And this photo, he is looking out the window at his daughter who is standing outside. She took the photo. You see her reflected in the bottom of the photo.
Yes.
She's standing in the wet grass. George has gray blue eyes and wrinkled forehead. And this photo was taken during the summer. George has been living in a retirement home in Ontario for the last 5 years. He moved in with his wife, Grace, and he wasn't really ready to move in, but Grace's health wasn't wonderful. And a few weeks after they moved in, Grace passed away. And so George was on his own, and his kids were very worried about how George was going to do. He was a lifelong outdoorsman. He'd been actually chopping wood for their home up until they moved in. So at age 91, he was still chopping wood. And he only stopped because it was hard on Grace's lungs to have the stove going in their house. So he's in there by himself, and his kids are worried. And he did great. He flourished. He's a real social butterfly. So he'd go to all the dances and bingo, and he's very active. He told me that he estimates he walked about half a mile every day going to his meals and back. And then when COVID struck and the focus was really on getting PPEs in hospitals, George's retirement home, like so many across the country, went into lockdown. And so he stayed in his apartment. There was no more shared meals in the dining hall, so his meals were delivered. And George had a chronic cough. And so he was identified as a possible case of COVID. He couldn't get testing at the time. And so meals were just dropped off outside his door by someone in masks. He brought the tray in, ate, and put it back outside. And he went 2 weeks without seeing anybody. And he just stopped eating. And he said to me, you just don't need so much food when you're not being very active. And George ended up in the hospital in June, and that's where this photo was taken. His family couldn't get in to see him initially. And when this photo was taken, he said to his daughter, I don't want to go back to the apartment. And George, like 40,000 other Canadians, was on a wait list for a long time to get into long-term care. And his family was in the quandary that so many Canadian families find themselves. What do you do? Do they keep paying for his apartment? Do they convince them to leave him in hospital? And finally, they brought him home. They decided that would be best, brought him home to his apartment. And he just never quite bounced back. His kids were allowed to come visit, so they would visit, but he still had to have his meals on his own. And George passed away in hospital at the end of July.
And do you think, I mean, you're not a doctor, obviously, but you can tell us what those who knew him and who cared for him said. Do you think he died of loneliness?
I don't know if he died of loneliness, but his last months were very lonely for him. And when I talked to him about what he wanted, he said, this virus is serious and we have to respond to this. And he said, this isn't the toughest thing I've ever gone through, He had actually been in a quarantine because of a mumps outbreak when he was in the army, living in a barracks in Ontario when his first son was born, and he didn't get to see him for several weeks. But he just missed having people around and dancing and meals, and he just didn't want to continue.
Nathan Stahl, how reflective is George's story of your experience with older people?
It's tragically far too common. We see a lot of older patients who have lived through traumatic experiences earlier in life, whether it's the Holocaust, whether it's world wars. And at the beginning, the common refrain was, we've lived through these experiences, we can live through COVID. And as the month wore on, this is quite a chronic experience of isolation and loneliness. Many of them told me, we've lived through that, but this is no way to die. I've seen so many older adults, and I've heard from families and caregivers about experiences like George, where as the months wore on and older adults were isolated and lonely in the way that they were, there was accelerated cognitive decline. So many people went, particularly in congregate care settings like long-term care and retirement homes, where after the lockdown was eased in many jurisdictions across the country, caregivers went back in and their loved one may not have recognized them anymore. I've seen people who went from walking to wheelchair bound and from requiring help with a few activities to complete their daily activities, but that progressed to being fully dependent. And then, of course, there's tragic cases like George, where they sort of dwindled over the course of this pandemic and ended up tragically dying. So I have no doubt that when all is said and done, and when we have all the data, and we mostly have the data thus far on COVID-19 deaths, that we are going to see another toll of this pandemic, which is this toll of loneliness and social isolation and the impact of the conditions of the pandemic, not just the deaths from COVID-19 itself.
Leslie Weisenfeld, what are you seeing and what are you experiencing in your practice?
Thank you. I think that what I've really been seeing and I've been thinking about is what I might describe as kind of the psychological and also the psychiatric. I think the psychological impact is interesting because there's so many people who are kind of 70 something and above who didn't really think of themselves as frail and vulnerable. And, I think we all realized so much of the messaging initially around from public health officials, which was so important around guidance and safety. It really highlighted to so many people that they were in this kind of group that needed to be so fearful, so afraid. And so what I've seen is this sort of psychological experience of older adults who might have seen themselves, as Christina described, as really vital, really, kind of active, who then needed to think of themselves as the most vulnerable and really kind of impacted their self-concept in a way that has been, really sad as Dr. Stahl and I both work together. We spend so much of our work trying to empower older adults and help them to feel, vibrant and as active as they can. And it's nobody's fault. It's just the effect of some of the direction, especially in the early days. And so I've seen this sort of psychological, almost like involution, this kind of withdrawal that's happened for older adults around their, self-esteem, their sense of mortality, their sense of trying to balance like their physical health and their mental health. And I think so much of the messaging really privileged, understandably, their physical health in a way that made people feel really small and really fearful. And then I think on the psychiatric side, what I've seen, is that it's really, really hard for people who are getting more mentally unwell to access care. As many of us have talked about, one of the great things about psychiatry is you can do it virtually, like the way we're doing this conversation, but you can only do virtual care with people who can do virtual care with you. And so many older adults are marginalized, they can't access, kind of technology. And that's not meant to say that there aren't older adults who are very savvy. There are, but there are lots of people who were marginalized before this who can't access social supports, let alone psychiatric support. So it's like a double hit in terms of their well-being.
Christina, we pointed out earlier that you wrote about this for Maclean's a couple of weeks ago, and I want to read an excerpt from that article just to set up our next point of discussion. From the beginning, you wrote, there's been one constant with COVID. There's never a painless option. Living with the virus always involves some kind of taboo trade-off, staying home or going into work, hugging grandchildren or keeping a virus at bay, allowing spouses to visit or shutting the doors of long-term care to anyone who might bring in an illness. But somewhere in those trade-offs, individuals have the right to make choices about their lives. Well, this really gets to the nub of a very complicated issue, which obviously decision makers are dealing with and families are dealing with, and that is, well, partly is the cure for COVID worse than the disease itself, and have decision makers taken the ability of families to make their own decisions out of their hands in the interest of broader public interest? Why don't we get into some of that? Christina, what can you tell us on those two scores?
I think we're failing our older adults when we talk about this in really black and white terms, that the only options are isolation or not. And that's simply not the case. We have a lot of things we can do as families and as communities to help out older Canadians and to support them. And so one of the things that Dr. Samir Sinha had said to me is that this is a conversation we don't get to make for our grandparents or our parents. This is a decision we make with them. And we sit and talk to them about what is important. Think of it, what I found really helpful was to say, think of this as a kind of advanced care planning. Like we often think of advanced care planning as something you do for the very end of life. About what I would do for someone I love if they could no longer speak for themselves. But we're talking about a quality of life issue here. And so sit down and talk to people about what really matters to them. Is it most important to my parents that they have visits from their kids and their grandparents? And if so, how can we as a family have that conversation about how to do that as safely as possible for them? And maybe it means that I don't go out and spend my nights in restaurants or in pubs or whatever else, but my most important priority in my life is making sure that I get to see my parents and do that in a way that's safe for them.
Yeah, Dr. Stoll, I think we know that about 2/3 of the deaths in the province of Ontario have happened to older people who are living in long-term care settings. So obviously, that's a crisis, and obviously we want to do everything we can to protect those people from dying. Having said that, I do want to ask you the question directly. Do you think that we have, not we, but I guess the decision makers have gone overboard in the cure for what ails us at the moment?
Yeah, it's a tough question. What really turned my head around was in June, a group of French long-term care physicians wrote an article in one of the long-term care journals. And the title of the article was, "The Confinement Syndrome May Be Worse Than COVID-19 Itself." And they noticed that they actually termed this confinement syndrome, which is a term appropriated from other conditions of confinement, solitary confinement, in fact. And they noticed some of the things we described up front, that older adults in these settings, which had endured months of conditions like George had endured, were really not thriving. And in fact, were experiencing the deteriorations we noticed. Now, when a lot of the visitor restrictions were imposed on congregate living settings, and that would have been in the province of Ontario on March 14th, I think that was probably a reasonable thing to do. This was an intensifying catastrophe. The long-term care sector was clearly unprepared to deal with it, and they needed a blunt response. The challenge and the issue was that this lasted far longer than I think it needed to last. And, as the rest of society started to open up over the summertime in the province of Ontario and across the country, we kept residents in these settings in conditions of lockdown well through the summertime, into restaurants, bars, and other settings were open. And older adults are less able to tolerate the deprivation that they were experiencing in some ways. So many of them, without the ability to, for example, go outside for walks, many of them experienced that functional decline. To the credit of the province in Ontario, they actually recognized this, and I would argue created one of the more compassionate and balanced visitor policies by distinguishing in early September between the types of people who want to access the homes, meaning that there are people who are coming for social reasons to visit people, but there are also family caregivers who, prior to the pandemic, were coming in multiple times a day often to feed residents, to help them with basic activities of daily living. The province of Ontario now allows residents or their substitute decision makers to designate two family caregivers who can enter the home without serious restrictions on limits or frequency of access, and even during times of outbreak, which I think is the type of balance and nuance in the policies we need to be pursuing when we think about older adults, so that we can both protect them from the disease, but also not cause untoward harm by overly severe restriction.
Dr. Weisenfeld, do you think the quote unquote blunt response has been too blunt?
Oh boy, I mean, it seems almost too easy to be critical, but I have a few thoughts. I think that we need to add probably more empathy into some of the public health communications, more that kind of acknowledges, as Christina was saying, that there are nuanced and kind of balanced decisions that need to be made to help people to decide amongst risks. I think the challenge, is, if I think about it even myself, I wear a lot of hats. I work in a hospital where people are working really, really hard to get ready for people who may need more help related to COVID positive illness, and are really attentive to this kind of balance around restrictions that will help keep the healthcare system running, and also be able to kind of provide care in a safe way. As Dr. Stahl said, we're trying to balance around visitor policy in a humane way that's empathetic, as well as trying to make sure that we keep people in our hospital, including our staff members, safe. I do think that, whether it's because people had optimism that it would only be a short period of time, which I think Dr. Stahl is right about, or whether it's because people were so worried that if they didn't give guidance that was blunt enough, that people wouldn't follow it. I mean, it's easy to look back, and all of us have more ideas about what we wish would have been true. I think though that we're probably all saying, if I can speak for my colleagues on the conversation, is that we need something that is maybe a little more attentive, that a senior citizen or an older adult is a grown-up, is a person who has lived a life, has reflections on their values, has reflections on meaning and what they hope for. And I think what's happened is, older people being considered in a bubble has also taken away their voice around being able to have really important conversations about what they look for in their quality of life, not about going beyond the restrictions, but within them being able to have really important conversations with their family members about what's important to them. And I think also empowering their kids to not just frame it as like, I would feel terrible if something happened to you, Mom, but allowing an older parent to say, but let me tell you what would make me feel terrible. What would make me feel terrible is not to see you, not to be able to wear a mask and maybe sit 6 feet apart and have a conversation. And I think it's been a bit one way from the beginning, and I think we need to make it a two-way conversation.
We started our conversation talking about George Spalding, who's from Cochrane, Ontario, in Northern Ontario. And now, Christina, I would like you to tell us about Diane Parker from Halifax and what your takeaway from her story was.
So she's another person I spoke with for this story, and she's a retired rector. So she no longer manages her own parish, but she still does funerals and weddings. And she has been a longtime advocate in Halifax, speaking out against isolation of seniors. And she has so much energy. And when beginning in March, she went sort of into lockdown, all her services were moved online. And she worked with her community to try and find ways to make sure that she was connected. And she was adamant that people have a choice in how they connect with people. And so she has the photo there you see with her happy stick, and she used that to pass baked goods to her neighbors who lived nearby.
Now, I'm going to jump in here for a sec, Christina, because for people listening on podcast who aren't going to know what a happy stick is or what she's doing, you better describe what's happening in that picture.
So you see a woman with white hair standing on her porch holding out this stick that looks like a long cane. It's 2 meters long, I think, and she's passing a bag across to another balcony where there's a family standing there waiting to receive the gifts of whatever's in the bag.
So that's the way to do it when you have to be socially distanced, right?
Yes, and she would set up these elaborate window displays around Easter, and I'm sure she has something in the works for Christmas. She has a clown ministry under normal conditions, and so during COVID, she dressed up as a clown and walked around her neighborhood to make the kids laugh, and she built a lower deck to her front porch that she calls her COVID deck. And so she could sit on the top level and someone could sit at the bottom level and they could sit outside and have a chat while being socially distant.
Well, she has clearly figured out how to roll with the punches during this COVID-19 era. Nathan Stahl, I guess I'd like to find out from you, some other alternatives. What are some other ideas that you're hearing or seeing where people can overcome the loneliness and yet still respect the healthcare protocols at the same time?
Yeah, I think what we're getting at here is, and it's important to recognize this, that the older adult population is not homogeneous, right? So the things that worked for this rector in Halifax in terms of virtual connectivity and creating additional space may not work for everyone. So when we create policy, we have to take into account that a one-size-fits-all solution may not work. Let me jump back to long-term care retirement homes for a second here. One of the things that I have seen as a more creative solution to this is recognizing that transmission of COVID-19 is greatly reduced in outdoor settings. The province of Manitoba, for example, where I was born, actually built all-season visitation structures outdoors so that people can come visit their loved ones in a climate somewhat controlled setting outdoors. They're actually reappropriating shipping containers. And that's a way to have connectivity, give residents hope that they can still connect with their loved ones a little bit closer to them through windows and not have visitor traffic coming through the home. So I think that there are ways that we can do this. It just takes some will and sometimes it takes some money. And we need to prioritize this for older adults, recognizing that without the social interaction and the other needs that need to be met for older adults, we will see the decline that we have in the past.
Nathan, is that going to work when it's minus 25 in Winnipeg in February?
Well, Winnipeggers do all sorts of interesting things in the wintertime, right? Whether it's running or skating, they're pretty used to the inclement weather. We'll see. They actually started constructing these and thinking about this in June, right? So this was something they thought about in the summertime, recognizing that winter was coming. They have done these outdoor visitation structures or booths in other settings as well. And I think that's one creative solution that could have an impact on residents' lives.
Leslie, I wonder, in a strange way, when you're talking about people, for example, who are in their 90s, when you talk about long-term impacts, there isn't necessarily anything long-term about anything when you're in your 90s. But having said that, as you think about how that generation is going to deal with all of what it has dealt with over the last 8-9 months, what comes to mind?
Oh boy. I think that, we've all been reflecting the last several months about how long this has gone on and what an imprint it's having. I think fair to say for a very older person, it's one of many things that they'll reflect on as kind of a thing they lived through, wouldn't have imagined, and got through to the other side of. I do think that for a very older adult, I think that they will do what people have always done. People integrate, kind of challenging and traumatic experience into, kind of their own sense of wisdom. As corny as that may sound, it's been a fact ever since people lived through wars and famines and other disasters. And I think if I can just add, if you don't mind, to even the question that you were asking of Nathan, that I think the other thing people will do, and I hope they will do, is they will, rather than wait for some of the restrictions to be over, they will use this as a chance to reminisce about, the things they've learned through other crises and what they feel like they've learned from this experience in terms of, kind of the perspective they have on the value of their family, of connection, of the creativity that they may have had. And they will reminisce about how they will incorporate this particular experience, into their life. I think one of the biggest risks during this kind of extended set of restrictions is that people wait until it's over to kind of get back to normal instead of trying to integrate the things that have meaning and value to them into their day-to-day, whether that's picking up the phone and talking to someone about what they miss about them, as opposed to waiting until they can reconnect again. I think that's one of the shifts that I'm hoping people will make, because I think early on, we all thought it would be over in maybe a few weeks or a few months, and we just waited. And I think now it's really time to stop waiting and think about what could we do that's kind of the most connected to who we are. So we're living in the moment rather than waiting for the normal to come back.
But let me do a quick follow-up with you. For example, talking to that sandwich generation who are dealing with older parents and also their own children, give them some advice. If their parents say to them, look, I know you're looking out for my health, but we can't stand the isolation, and you and Dr. Williams and Premier Ford, you've all got to back off a bit and let us live our lives a little more. The response to that should be what?
I think the response to that can be, kind of, Mom, I'm worried about you, and I'm sorry if I've done anything to kind of make you feel like you should be, restricting yourself in a way that, makes you feel lonely. Let's talk a little bit about how we might be able to meet in the middle, because, I need to feel like I'm doing my best for you out of love. And I know you also need to live your life. Let's figure out, how I can stop constraining you, but also how, I can cope with what I hope doesn't happen. And I don't want to have to kind of reflect and regret some things that I either allowed or kind of tolerated. And I think what I would say to those folks that you're wanting to give a script to is, let's watch our own language and be careful that we're not infantilizing, our parents and our grandparents, and really try to respect that they're also really speaking up and telling us what's important to them.
And Nathan Stahl, in our last minute and change here, could you tell us whether you are hearing anything from the upper levels of Public Health Ontario or the Premier's office or anything like this, which suggests that they understand the nuances of the conversation we've had tonight, and that they may be rethinking or reevaluating and I'm going to use a bad word here, so you give me the right word, the kind of paternalistic approach that they've taken, which is, we're going to decide what's good for everybody, and there are not many shades of gray in all of this. Are you hearing anything about that?
Well, I think, the visitor policy that I spoke about welcoming back caregivers in early September reflected the fact that they listened to advice that our group gave, and that several other groups across the province and the country gave, about recognizing that residents need their caregivers, and that not all people trying to enter long-term care homes are there for social reasons. So the fact that they implemented a more progressive visitor policy that exists in many different jurisdictions of the world gave me a lot of hope that they were receptive to this. The other thing to recognize is there's a concept of shielding, which has been proposed, where you try and allow transmission of COVID-19 in the community and try and shield the more vulnerable population. That has not worked in any jurisdiction. There's no empiric evidence that you're able to effectively do that. We're seeing that here in Ontario as well, where less than a quarter of all cases are in people 60 years of age and older, but they account for about 2/3 of the hospitalizations and more than 95% of the deaths. And I think recently as well, after we had some, I would argue, dithering and delays in terms of implementing more or implementing public health policy that acted to more aggressively suppress the virus, I think there's a recognition that that's not going to work as well. So I do think that they have been receptive when they have needed to be. Has it always been on time? No, unfortunately.
I really want to thank you three for coming on here and having a conversation that apparently is long overdue and really helpful, I'm sure, to the people who are watching this. Leslie Weisenfeld, Nathan Stahl, Christina Frangu, thanks so much for being on TVO with us tonight. Much appreciated.
Thank you for having us.
And that is the agenda for Wednesday, December 2nd, 2020. Tomorrow on the program, we'll be looking into the state of Ontario manufacturing. Once the economic engine of Canada, we'll examine its potential to boom like that again. I'm Steve Paikin. Thanks for watching TVO, for joining us online at tvo.org, and we'll see you again tomorrow.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.